Welcome to Business Connection. I'm Liz Spencer. We have Pam Davis with us today. Welcome, Pam. She's the Edward-Elmhurst Memorial System CEO. Pam, everybody knows you because Edward Hospital is such an institution in our town and something that we're so very proud of. And you've been the leader for 25 years.
It feels like just yesterday, but I'm really, really proud of the organization as well.
Now, in your 25th year here, you've made a really big change.
We did. We've entered into our first merger between Edward and Elmhurst Memorial Hospital, which is really quite an exciting and large change. It makes us now a $1 billion organization.
Wow.
7,600 employees. Huge geographic spread with our physicians and medical office locations. So it really ties our two service areas into a nice quarter right along the east-west corporate tollway.
Well, I think that might answer a question I was thinking about. Why Elmhurst Memorial? There's a lot of other hospitals.
There are, and actually DuPage County has some of the finest hospitals really in the world, and we should all be proud of all of them. When we were looking at a partner, it really is to address some of the reform issues with healthcare reform. And with healthcare reform, what it will require all hospitals to do is to really work in an efficient manner to keep patients out of the hospital setting and to be seen more in physician offices and outpatient locations. And so we need a larger geographic area, similar to an insurance company, where you have to have the law of large numbers so that you can keep patients healthy and spread risk out between those younger healthy patients and those who may be older with some chronic illnesses. So most hospitals are looking at a wider geographic spread. Then specifically how we selected Elmhurst is that it's a very high quality hospital with low costs. And so we thought together we could really manage a population with high quality and efficiencies.
Wow, because I think when you hear merger, we always worry. But this one sounds as though it's very well thought out for the greater good.
It actually is, and I don't believe people will see any negative changes either at Elmhurst Memorial or at Edward. Hopefully people will see positive changes. Right. And let me give you an example of that. Because we have now a wider and deeper base of patients, we're able to recruit some of the really high-end medical and surgical services from Rush, University of Chicago, and keep those physicians busy and engaged right here in our community hospitals. So you'll be able to have really high-end surgery at either Edward or Elmhurst due to the fact that we have this larger population base.
And that is so critical, because when you're sick and you're here, you want to be able to get great service here and not have to travel, because that's just an added stress.
It's a stress to the patient, to the family. And really, there are very, very few things that anybody would have to go downtown to a teaching hospital for.
That's awesome. Tell me about the leadership and how the leadership has changed.
Okay, Lou Mastro has been designated the president and CEO at Elmhurst Memorial. And she was our past president of Linden Oaks Hospital.
Right. Awesome.
Yes, she is wonderful. She has worked with me for 25 years, and nobody can speak more highly of her because I have seen her in virtually every single situation. She's exceedingly bright, she's strategic, she knows operations. She had multiple jobs at Edward prior to going to Linden Oaks. So she has really been responsible for every single department, construction, facilities, nursing, all the clinical areas. So she has a depth of knowledge and background, and is already making a difference there. The feedback I'm hearing is that people really like how transparent she is, very clear in her presentations, and actually very visible. She's been making rounds consistently throughout the hospital, so people are already looking to her as their wonderful leader.
That's awesome. And we were talking a little bit about patient impact and or resident impact. We hopefully will not, as residents, see any change, maybe improvement.
Yes, I don't believe anyone will see any change. Right now, some transfers are occurring. We have our level 3 neonatal intensive care unit. That's the highest acuity that there is. Elmhurst is a level 2, and so some babies who are born at Elmhurst who really require high intensity care will be transferred to Edward. But that's going to be seamless and invisible.
And a great thing for that little baby that needs a little extra help.
Absolutely, absolutely.
Tell me about your doctors group and how this is going to improve physician care and interactive with everything?
We have a very large group of physicians, some employed, some in business arrangements, and many independent that work both at Elmhurst and at Edward. And we pride ourselves on having very strong physician relationships. And when I say that, what we want to do is make our hospital settings places where physicians want to come work. What are the things that would make them want to do that? Ease of ordering tests, of getting results back, having wonderful clinical care through our nurses and pharmacists, and actually even some joy in providing this wonderful work. And we think we've been really effective in the culture at both hospitals in really engaging our clinical staff, our physicians, and then that ultimately makes a huge impact on the patients.
Absolutely. Now, I think we all worry or wonder about the name.
Everybody is asking about the name, and I wish I could give you an exciting new answer to that. We have a legal name right now, which is Edward-Elmhurst, simply to fill out documents and paperwork. But we are hiring a specialized marketing and firm to help us determine what resonates with the community. Do we want to keep the two names, which are very popular, both at Edward and at Elmhurst, or do we want to try and look at some creative new name? And sadly, we will not have a name for about a year.
Well, that's okay. I think we can wait. We'll wait with eager anticipation of what that's going to be. As we mentioned off the top, this is your 25th year. What do you look back as one of your major accomplishments? Is this pretty high up on?
Oh, this is a huge one. But some of the accomplishments in the early days when things were very difficult at Edward and we didn't have the physician base or a patient base, and this is going to sound silly, but one of the things that really helped turn the reputation of the hospital around was that we were the first hospital in Illinois to have all private patient rooms. And that change certainly added to less infections, to privacy, to much more control by patients over their environment. That is one of the things I actually think was a very innovative thing to do at the time, because nobody else was doing it. So as small as that may sound, that to me was, an early good decision. Certainly the merger surpasses in terms of size and scope that situation, but this is it's something that I'm used to dealing with, actually.
Right.
Change is fun, so this change is good.
Well, that's good, and change is important, and I think Edward has done a great job of introducing us to this brand new facility, the Edward-Elmhurst Memorial System. So thank you. Pam, thanks for stopping by and telling us a little bit about it. I know we're all curious as we drive by it almost every day.
Thank you. It's been my pleasure.
We'll be right back with more Business Connection. Stay tuned.